I'm Dr. Sidney Smith, and I'm here at the American College of Cardiology meetings in Washington, D.C., where the FOURIER trial has just been presented. This is a very important trial that looks at a new way of lowering LDL cholesterol, the use of a PCSK9 inhibitor, which is an all-human monoclonal antibody. Now, we have known for several years that this medication could substantially lower LDL cholesterol even after patients have been treated on high-level statin therapy. What we have not had is information about patient outcomes. Not just does it lower cholesterol, what happens? Do they have fewer heart attacks? Do they have fewer strokes? And so the trial FOURIER, which followed over 25,000 patients treated with PCSK9 inhibitors after they'd had maximal statin therapy, provides us with important information about outcomes. Over 25,000 patients, they were globally recruited. So we have patients from China in this trial, from Korea, from Japan, many of the areas where we have American Heart collaborative programs with quality improvement. We have information from this FOURIER trial that can be used. Very, very helpful. And I asked the question as one of the panelists from the people that presented the trial, were the results the same in China and East Asia as they were in other parts of the world? And the answer was yes. Now, I asked that question because in China, we know that lower doses of statins are used. We've got a much more pronounced reduction in LDL cholesterol with a lower dose of statin. So it raises the question, are you going to see a benefit in a population where they already react to statins a little more than we see in the United States and Western Europe? So the answer was, it appears from this trial that the use of PCSK9 inhibitors does have some future applicability in China, Korea, and Japan, where are some of the Asian countries that we are interested in. Now, the trial only went for 2 years. And although there were reduction in the non-fatal cardiac events, the number needed to treat was 74 to achieve this. That's pretty expensive. So we think that we need about a 4-year follow-up to really understand how PCSK9 inhibitors may benefit patients all around the world. These are very expensive medications, and we need to be very careful to know which groups of patients would benefit. Right now, they appear to be a group of patients that has a mortality from their disease of roughly 5% per year. That's a high mortality. So it's a higher risk group that appears to benefit from these medications. We have learned that they can be tolerated safely. So we don't see problems with memory or problems with blood glucose or things that people had worried about when LDL cholesterol is treated down into a range of around 30 milligram per deciliter. Good news then from the FOURIER trial, a global trial which affects not only the treatment of patients in the United States and Western Europe, but globally, because there are many, many countries where patients were entered into this trial.